How can you help someone who has high altitude sickness if they don't have any other health conditions?
So we've already said that stopping going up is the most important thing, and really what they need to be doing is going down, preferably. Um, Again, that's not always the answer. So if someone's got acute mountain sickness and they're not too bad, they've got a bit of a headache, they may be a little bit off their food or feeling a bit sick, they could just stop ascending and rest for a bit, make sure they're drinking plenty, maybe take some simple painkillers for the headache like paracetamol, ibuprofen if if they don't have any allergies or problems with those medication, and give it, overnight. And if they're feeling better the next day, happy days, problem solved. If somebody's displaying more severe signs of illness, they're feeling really, really unwell, or vomiting a lot, not able to keep down fluids, or have had some painkillers for a headache, but their headache's just getting worse and worse, or they're showing signs of HAPE and HACE, which we described earlier, so very, very short of breath and not able to breathe properly, very, very exhausted, or showing any signs that their brain isn't working properly, like not being able to walk properly or being confused, anything like that, the more severe ends of the scale, then they absolutely need to go down. What they need is more oxygen, and the way that we give that is by going down in altitude to get to a more a higher oxygen environment. There are certain medications as well that can help to treat these conditions, but they only help. They don't cure the problem. What the person needs to do is get down the mountain. Depending on where you are, or what trip you're on, there may also be other help available, like oxygen in oxygen tanks where someone can wear a mask to have oxygen delivered to them. And in some places, there's also, or on some trips, there's also things like a portable altitude chamber, which is like a big bag that a patient can be put in and treated in the bag when it simulates a higher oxygen environment. But even those two things, which are excellent and definitely have a place and are really, really helpful, they don't cure the problem. The patient still needs to go down. Sorry, I'm saying patient. The person with the problem still needs to go down. Descent is the most important treatment.